Good afternoon. This was a very intense summit. Lots of information, lots of commitment, lots of money, starting from Sheikh Mohammed bin Zayed Al Nahyan, the Crown Prince, passing through UK, Canada, and also at the end we heard of the Bill and Melinda Gates Foundation donation. And basically earlier in the morning we had also sessions where we discussed in my session the importance of coordination between different parties, whether was it companies, like private sectors, governments, foundations, religious leaders, and traditional leaders. We discussed how such worldwide coordination would deliver a global health victory in all aspects. Also, my colleague Michelle tackled the steps in which the global polio program is taking to contribute to routine immunization system under the new global polio eradication initiative strategic plan and the benefits polio efforts can bring to other areas of the vaccine enterprise. In this session, basically we will discuss the challenges, also the lesson learned and best practices focusing on the underserved and unreached children. We'll start the session as the rest with 3 minutes remarks or observation from each of our distinguished speakers, after which we'll have an open discussion. Of course, we'd like to hear from our audience. Please make your comment or question short and brief, straight to the point. Mention the name of the person in question, if you don't mind. And basically, allow me now to introduce my guests. I start with you, Dr. Margaret Chan, Director General of World Health Organization. Welcome. And we have also His Excellency Jose Vieira Diaz Van-Dunem, was that right? Minister of Health, Angola. And then we have Zulfiqar Bhutta, Founding Director, Center of Excellence in Women and Child Health, the Aga Khan University, Pakistan. To make it easier, we will call him Zulfi, according to his request. And also we have Xiaolin, President, Chinese People's Association for Friendship with Foreign Countries. Welcome. And last but not least, Andris Piebalgs, European Commissioner for Development, European Commission. Thank you very much for giving us your time. Thank you very much and welcome. And we start with you, Dr. Margaret, and with your observation.
Thank you, Ms. Azzam. Good afternoon to all of you. All protocol observed, and let me go straight to the important points. We are here, friends, to talk about sustaining the gain from vaccines, the power of vaccines that save millions of lives. We are also here to talk about strengthening routine immunization. Why is it so important? Well, friends, yes, quite right, we should thank countries, partners, civil societies, and all the heroes you heard about the great success and all the improvements that have been made over the decades. You heard Bill Gates' presentation last night on the dramatic reduction in the deaths due to the power of vaccine. That is commendable. We need to maintain that. But in order to do that, what needs to be done? And I truly believe that we need to strengthen health systems, particularly the immunization system, to make sure we get universal coverage. Now, what does it take to get universal coverage? From the experience of WHO, I have 194 member states. They are my bosses, actually. And continuing political commitment, country leadership, to have the right policy to deliver all the antigens of the vaccines in an integrated manner is extremely, extremely important. Now, other than political commitment, you must walk your talk. What does that mean? Put money to where your mouth is. Domestic investment is important, but also we want to have external resource support. So I want to thank Bill Gates and all the countries, the development partners, for their generosity that was announced this morning. We need these resources to build the country capacity, to have the right healthcare workers, vaccinators, make sure we can purchase vaccines at an affordable price, and make sure we have the logistics, the cold chain, but more importantly, a monitoring and evaluation system to report on progress and results. That is important politically for country leadership. For ministers of health and prime ministers and presidents, you need to convince your people that you take their health to heart. But it is also important to reinforce the kind of commitment from development partners that we are seeing. We need public-private partnerships. Gavi is a wonderful example that bring people together not just to mobilize resources, to introduce new vaccine, but more importantly, to make sure the health systems deliver performance. And last but not the least, we heard about the importance to mobilizing the community, get their trust, get the religious leaders supporting local leaders, parents, and then they are all important partners in this whole scheme of things. Let me finish on one point. In the 70s, when the expanded program on immunization was introduced, we were talking about 6 vaccines. Now we have in the pipeline 22 vaccines. We really need to be very smart in having a good system to deliver all these antigens to protect our children, to protect women and men.
And that's what we are going to discuss, how to apply
Exactly.
that.
I'll come back on that
later on, Your Excellency. You can start your comments.
First of all, I would like to bring you the greetings and best wishes for the success of this summit from our President, José Eduardo dos Santos. Angola enjoys today a well-deserved peace since little more than 10 years. The country is going through an accelerated process of infrastructure reconstruction, training of national staff, and development of its economy, in which health appears as a fundamental and a decisive pillar. One of our main objectives is to make our national health system stronger, more efficient and holistic, giving the highest priority to primary health care and public health, orienting our national health service toward the prevention of diseases and appropriate response to immediate health needs of our people. We are consolidating the reform and the institutional strengthening of the health sector, namely through the administrative, technical, and financial decentralization of the health service to increase the access to and use of primary health care, promoting equity and health gains. During the last 12 years, more than 50 polio vaccination campaigns were implemented countrywide. The epidemiologic surveillance and the routine vaccination program were also greatly improved with investments in human resource training and strengthening of the cold chain at all levels, allowing us to achieve in 2012 a routine polio coverage of 88%. Our 5 years 2013-2017 National Health Development Plan includes as one of its top priority the eradication of polio, the control of measles and the neonatal tetanus, the prevention of acute respiratory infections and diarrheal diseases through the universal access to routine vaccination and to the introduction of pneumococcal and rotavirus vaccine in order to further reduce under 5 mortality. The key interventions regarding immunization are the following. First, sustainable and uniform increase of routine vaccination coverage in all municipalities and communes, with special emphasis on reaching missed children in all municipalities at risk for polio. Second, extension of vaccination service to all public and private health units. Third, maintenance of high level of motivation and commitment among vaccinators and supervisors to ensure the highest quality polio campaigns.
And finally?
Final maintenance at high level of commitment and support from the provincial and municipal authorities, ensuring sustainable financial support to immunization program, including for the introduction of new vaccines against pneumococcus, rotavirus, and human papillomavirus.
Okay, thank you very much. And I'll jump, Zulfi, I'll just go to Mr. Andris so that we can make sure at least to hear his comments and remarks.
Thank you very much. It's very sweet. Well, summits for me is usually the moments of triumph and despair. Triumph because it is international community that comes really to take stock on great engagement and pledge money. And I admire that this 4 billion pledge for eradication of polio. Despair because I know that I have a mid-May pledge for supporting people of Mali, then supporting people of Somalia beginning of June. And we have a lot of engagements. And then the question is, how in the times of limited financial means, you split your attention and financial means to supporting particular initiatives, that you don't lose money on not having complementarity, or you don't lose spending money that actually is a not most important parts of the system. Until now, the logic that we followed in the healthcare inside the European Union have been very much based on Millennium Development Goals. It's maternal health, children under 5 years of health. And immunization is part of it, very logical part of it. And now the question comes out, well, first of all, until 2015, we need to continue on to achieve better results. We use additional 280 million for healthcare. I recently signed, for example, a program for supported maternal health with Ghana. But particularly the question, what are the building blocks post-2015 development agenda? And here definitely I'm looking very much on WHO, because that is a body that represents a global community. What are real priorities? And I assume on the basis of polio, we clearly understand that it is one of the best ways to immunization to prevent people from suffering and prevent unnecessary costs later on, because treating of the people, economic loss of costs, it is a very effective way. And I assume that the target could be for international community that all children, all adolescents, all pregnant women are vaccinated. Well, we need to design the time period, and then actually we need also design the support of financial means. And we also need the courage. And that's why polio eradication is so important, because it's 232 cases. You would say, well, what does it mean? It's a lot of not. Well, it is a small number, but it is a still existing danger. So get rid of it. And that's, I think, it was the spirit of this conference. For EU, what does it mean? Basically, it would mean in a couple of areas. One, support country systems that they are being able to continue routine immunization. Then support, vertical vehicles that makes it economies like Gavi. And then also support definitely all other initiatives that support this global drive where the global community would like to go on health. Thank you.
Thank you very much. Exactly on time. And now we'll move to Zulfi, because we jumped.
So thank you very much. And let me start by expressing my gratitude on behalf of the community that I serve, that we've been invited to participate in this coalition. And it's a community of people who are involved in science, in research, and particularly on the implementation side of all that you've spoken about and are talking about. But this has also been a fascinating day and a half, because within this period, having filled the $5.5 billion gap that we started off with $4 billion of pledges, one has to ask, what does our community bring to the table? And I think what we bring to the table in terms of the value in kind is the partnership in terms of making things happen and asking ourselves to rise to the challenge of doing things better. So let me start by making 3 brief observations, and then we'll get into that, hopefully, as we discuss things. The first is, what is the link between polio eradication strategies and what is being termed as routine immunization, and what my friend Ciro in the audience would call immunization systems, is with very little differentiation between routine and others. So recently, we put out, with Walt Orenstein and I, a scientific declaration on polio. And amongst the many things I've done, I've never seen so much response and resonance for people in the science community to come forward and be willing to stand up and be counted. Now, the main elements of this scientific declaration going forward talk about things that we need to do over the next few years to make things happen, to eradicate polio. And they talk about integration of polio with not only immunization systems, but also with things like maternal child health and nutrition. things which are very close to the hearts and the demands and the desires of communities whose engagement we need to seek. At the same time, I think it's important to take stock of what have we learned over the last several decades on what makes immunization systems tick. And there is not a one-size-fits-all solution. There are many countries who have achieved this on the backbone of very strong, good health systems, and others have been able to put in innovations in the background of grinding poverty, inequities to make things happen. So I think some of those lessons that come out of the science and rigorous analysis are of great value to us in moving forward. And finally, as we move to the post-2015 agenda, when countries, policymakers, and the global development community is looking at the new challenges, we've got to ask ourselves, are we going to look at immunization systems in isolation? Or are we going to look at these as an opportunity to open the door to making this a very integral part of the human development agenda, to what the Honorable Director General of WHO called universal health care? But I would say this is also an opportunity, Dr. Chan, of making this equitable universal access and care, things that will resonate with our communities.
Thank you very much, Ms. Lee.
Good afternoon. I'm from China, the Chinese People's Association for Friendship with Foreign Countries, which is the most popular people-to-people exchange organization in China. I'm very pleased to be here and share with you how we do in China to strengthen the routine immunization and eradicate polio. China successfully eradicated polio in 1995. In the year of 2000, the World Health Organization officially confirmed that the Western Pacific region, including China, have eradicated polio. Polio used to be an epidemic that hurts 20,000 to 34,000 kids each year in the 1960s in China. In 1960, China invented the polio vaccine by itself and then started nationwide immunization from 1965. With 10 years, the incidence of polio decreased by 37%. In 1991, the Chinese government made a commitment to eradicate polio and fulfilled its promise by October 1994. The success can be attributed to the 4 measures adopted by the Chinese government. First, to establish a nationwide immunization system. As you know, China has a population of 1.3 billion, which takes almost about 23% of the total world population. You can imagine how hard it is to immunize every child in the country, especially those children in remote areas. The medical staff in village and township clinics have been playing an indispensable role in ensuring the routine immunization for every kid. Second, to insist free routine immunization. China is still a developing country with millions of poor people. Every parent wants their kids to grow in good health. But some poor ones cannot afford immunization if it is not free. Free routine immunization guarantees every child isn't left behind. China now offers free immunization against 12 diseases, including measles, polio, and etc. Third, to increase people's awareness on immunization, people in remote areas and those who receive little education may not know why they need to have their kids to be immunized. It is the government's duty to let people know the importance, so education is very important. Fourth, to strengthen monitoring areas with higher incidence in the past. In some areas historically had higher incidence of polio. The Chinese government has been closely monitoring the situation and preventing the reoccurrence of polio.
And we'll go in depth about all the successes that your government did to share with other people and other countries. But before before you leave, Andris, I just want to point out about what you said regarding involvement, the EU involvement of lots of issues. How do you set your priorities?
Well, I think the main driver definitely is a global policy. As I told, Millennium Development Goal Framework is until 2015. What means outside that 2015, that is rather crucial, which goals international community will design, what accountability mechanisms it will provide for, and how the tracking would be done. So for me, very crucial debate that starts now, this high-level event in New York will design where the priorities should be and where we should be accountable. Because if the framework is not it, then it's very much depend on my political views or my perceptions, and that is not helpful. I believe that the international community should work together to deal with the main challenges, that they don't come back through the back doors.
And as a donor, how do you make sure that your investments are having sustainable impact?
For me?
Yeah, for the EU in general.
Well, for sustainability, well, it's... For me, the best indicator is definitely how good the country's system is. But for this, there is not a universal indicator. I would say ability to provide routine immunization could be some proxy indicator that would say, well, if country is capable to run it on its own means, you don't need any more donor support.
Doctor, you mentioned lots of reasons about the importance of strengthening... goodbye. He's leaving quietly. You talked about the reasons behind the importance of strengthening routine immunization. If this is very important, as you said, and everybody's talking about it, how important it is, why it continues to be an area of concern to lots of countries?
Well, there are, of course, many reasons why many people in countries, especially, people living in the rural area, far away area, hard to reach area, do not get the vaccine. And there's another issue of affordability. I'd like to make two important points. Number one, and I'm happy that Commissioner Piebalgs talked about the importance of post-2015, Millennium Development Goals, which cover maternal, child health, HIV, TB, malaria. I have heard every country in WHO, they want to continue because that is important for their countries. Now, let me focus on immunization. I talk about the importance of partnership. One sector we need to pay tribute to is the business sector. Now, I'm not in bed with the business, but I work with them. But make sure that there is due respect to guard against conflict of interest. Now, the development, the R&D development in many of these countries, we heard about it this morning from India and other companies. How can we make vaccine affordable, number one? And number two, how can we make sure new innovation, new vaccines can benefit people in faraway countries and villages? The timing from development to licensing is a major issue. Many countries require individual marketing authorization for vaccine. That is a costly process, that is a long process. WHO is supporting many of our countries. Now they see the barrier to access. And we are going to fast track that process to bring countries together to recognize the importance of harmonization of the regulation and also mutual recognition. The second point that WHO is contributing to this partnership is to conduct pre-qualification. Now, many good manufacturers in the developing countries are making huge efforts in investing the production of quality vaccines. WHO needs to stand behind their quality by examining the quality, safety, and efficacy. If they meet those standards, we should tell countries it is safe to purchase those vaccines. Now, for development partners, the pre-qualification program actually stretch your money. For example, before pre-qualification, a dose of vaccine can cost as much as $7, $10. After pre-qualification, the price went down to $2 or $3. So this is the kind of market competition that WHO, working with Gavi, is encouraging to make vaccine affordable.
Thank you very much. And basically, this is very important because it was discussed in the morning. So I think we're linking all the sessions together to at least reach answers to all questions raised. Zulfi, you talked about the linkage between polio and routine immunization system. In practice, what does it mean?
In practice, what it means is that you use the opportunity of what's been created within the polio program, which is unique information systems, a surveillance system for the disease, which is head and shoulders above what we have for routine immunization, tracking of proxy indicators, looking at disaggregated data at a level of unit of analysis, which is something that we've never had for health. For example, the program has information at sub-district level. So you're able to look at differentials of coverage and performance in a very unique way. And it's also used technology, information technology, GIS mapping, which we have never had for other disorders, leave alone routine immunization systems. The opportunity that we have for trying and linking immunization system information, and I would go to the extent of saying the health system information components that we have, is phenomenal. And it's up to us to try and see in the years going forward, how can we make that happen now?
We need to know about the challenges, at least from countries, on country level. What are the challenges with regard to strengthening routine immunization? Yes, please, sir.
Yes. For us, these have a special meaning. We have cut transmission 3 times, and we reinforce 3 times too. Why? Because we have good campaigns, but a low-level coverage of routine immunization. So, although we get success through the campaigns, we had not been able to protect the children in our countries. Only routine immunization combined with polio give the mass immunization that protects all children. So, it's key combine immunization in routine and the campaigns. But the main is the opportunity to set up a strong health system that can be an important tool to reduce the child mortality, to reduce maternal mortality, to tackle the MDGs and have figures that allow the leaders have opportunity to say that, in fact, your system, your health system are performing well. And as Zul have told, to allow the comparability in order to say where you are, in fact, the progress made, and so
maybe
be accountable.
We can learn from the experience of others from China, for example. If you can tell us, how do you share your experience with other countries?
From China, we did pretty well on polio. However, we think everybody lives on today's world. We need to cooperate with each other, sharing with each other's technology, and also sharing with each other's the good experience. For China, we would be very happy to work with international families. I think 4 points I want to make. The first one is we must urge government to pay great attention on this aspect. And the second, we must do education for your local people, for all the parents. For example, in China, when a new baby was born, the parents will immediately get a green book, which tells you the importance to bring your children back to the center to have an injection, vaccine. So that's very important. No matter how busy you are, you need to tell somebody, to ask somebody to come to the center to give your baby injection. That's so important, education. Thirdly, I think try to train a group of people who are very much talented, either to go to the countryside or go to the remote areas, because the people live so spread out, and even some of them live in the grassland, some live in the mountain areas. Therefore, we do need special people, treated, those people who could help them. We call barefoot doctors, or we call the doctors who are riding on the horseback. That means, you try to take every child. The fourth one, I think, we need to do everything like a family, international. Mm-hmm. So we should help with each other. That's so important. That's what China doing.
Thank you very much. And Dr. Margaret, when we talk about the international level, how can such bodies be able to help those countries who are not being able and have lots of challenges in strengthening the routine immunization system?
Thank you. WHO, I mean, at the global level, as an organization with 194 countries, the important is for us to use evidence as the basis for government to formulate good policies on immunization. As I said, without policy, without good program, money will not flow. So the country leadership is important to get that in place. WHO's value added is to help government to get the right policies and encourage domestic investment, but also mobilize external support to governments. But the country capacity is extremely important. The healthcare workers, the cold chain we talk about, and the accountability for results. These are the monitoring framework and tracking that we are doing. Now, you heard a lot of comments about integrating the polio success and also, leveraging on routine immunization. I think those are two very important pieces. But you also heard from, Minister from Angola, the importance of also to look at other services, like the mothers, maternal and child health. When the mother, WHO, we look at the mother and the child as a unit. I mean, if you take care of women, you take care of children. So the mother and the children come, you can provide a group of services.
Connected together.
That's right. And you cannot separate them. And the kind of systems we put in place is, as I said, without government leadership and commitment, we will not get it there.
Then we will have to talk about the commitment. We heard from your observation a lot of commitment. We are going to do this and that. Is there a real political will to apply that or not?
Yes. We understood that our country is a large country, and it was not reasonable to think that the Minister of Health in the capital could have appropriated information what was happening in the municipalities very far. So we transfer our responsibilities, national health program, to the administrators that are the political responsibles on a municipal level. And we transfer for each municipality $150,000 US per month to implement the health program, national health program. So we send the responsibilities and the money, and we could assist a huge improvement in the results related to fight for a better health for our population. Commitment means exactly this, to send the resources and the program and set up an important monitoring plan to be sure that the resources we are putting in their hands are channeled to the right direction.
Okay, I think the point is clear. I'd like to hear from the audience. Anybody would like to add anything, a comment? Yes, please.
Thank you very much. My name is Dr. Ayman Sheikh. I'm from Pakistan. All the things, we are talking about the strengthening of routine immunization. So everything is there, but we are missing the supervision monitoring. Like Dr. Margaret Chen has said that, in our country, we have the monitoring and supervision issue is there. Everything is available, and we are utilizing this also, the system of polio. And again, with this, we have to also accountability, not simple accountability, but meaningful accountability. So we are meaning accountability, we will achieve the goal.
Yeah, thank you for the comment. Any question or comment? Okay, Zulfi, if we talk about measles, measles has been getting a lot of attention because it's highly contagious. This year, it claimed lives in Pakistan. So what lessons are we learning from today's measles effort?
I think that's a great question because it's the recent measles outbreak in Pakistan and in several other places of the world have had different connotations. In Pakistan, the outbreak took place against a backdrop of a massive effort to eradicate polio, so an already existing system. Within that outbreak were several lessons. Now, what were those primary lessons? One, it told us how important adequate information and verifiable information is. So data systems. So you really need to know when you're talking about coverage, are the coverage figures exact? The second thing that you found out was the measles outbreak also was associated with an unacceptable case fatality rate because many of the health needs, the nutrition needs of these children hadn't been met. So massive rates of vitamin A deficiency, which actually killed children with measles, which it wouldn't otherwise. And the third thing that you recognized in that outbreak was how many missed opportunities there were. We depend upon immunization systems as if the rest of the health system does not exist, and Dr. Chan said that. In many places where you do not have vaccinators accessing populations, you have other types of health workers. You have community health workers. And therefore, there isn't any logical reason why you could not fill an immunization gap therein. Let me take this opportunity, if you permit, Mayssoun, to just digress for a minute and make a point from the recent exercise that we've undertaken in collaboration with WHO and UNICEF on developing the integrated plan for eradication or control of pneumonia and diarrhea deaths. Now, as we speak, pneumonia and diarrhea, two conditions that, as Bill Gates said last night, we've massively controlled worldwide, still kills about 2 million children under 5 every year. 2 million children. 800,000 approximately die with diarrhea. One diarrhea death in the developed world somewhere in a hospital would be headline news because no child should die with diarrhea. Now, in this integrated plan going forward, a product of 2 years of work, what do we see? We see three things. One, that if you look at interventions that will make a difference going forward to save lives, there are three groups of interventions that will make a difference. One is vaccines. One is water, sanitation, hygiene, environmental health interventions. The third is nutrition and community case management. Now, if you look at the contribution of each one of those to saving lives, the fascinating thing, it's equal. And they all work perfectly in a dynamic model if they are implemented together. So the point that I'm trying to drive home is that creating these silos of trying to save lives and control disease by disease-specific interventions when things are linked together. Nutrition is linked to immunization system success, as is the ability of health workers to access people in difficult-to-reach areas.
And have proper data, exactly.
It's all based on data, and it's all based on hard evidence.
Yeah, exactly, and that's why we concentrated a lot on the data and on monitoring everything in order to have maybe a full coverage for the routine immunization. What about China? What would you tell us about that point?
I think, for our government, we, as NGO, always urge our government to invest more on new technology, to invest in new vaccines. Because for infectious disease, that will hurt a lot of kids. I mean, baby or young kids. But as the fast growth of the economic development, we are facing some new challenges, like how to keep our water clean, how to keep our air fresh, how to let Chinese people enjoy safety of the food. So that's so important. So many people suffer from cancer today. So therefore, we think we need education, still education. We need financial support from the government.
You concentrated on that point, which is really important. Dr. Margaret, when we listen to the challenges and still the success stories, are you how pessimistic or optimistic you are regarding the commitment of all the entities that are here? After we finish this summit, do you think the work will be harder? And how can we continue this work after the summit?
Based on what I've been hearing in this summit in the last 2 days, I'm extremely encouraged. And also, at the same time, the discussion and debate in the World Health Organization by the 194 countries, I'm extremely encouraged. They understand the importance of investing in health and investing in particular in mothers' health and children's health. Let me finish on one extremely important point. You heard from Bill Gates' presentation. Over the years, we managed to cover 80% of the children, but that's not good enough. We need to reach out, do our best to reach the children that live beyond the roads, difficult to find places. Without getting our immunization coverage up to 90 and beyond that level, we're not going to get our job done. We are not going to get best return on investment. And I know that, given the energy in this summit, we will get there. I'm very, very optimistic.
Thank you very much, and thank you for being with us. I hope you enjoyed the conversation and the discussion. Thank you for my panelists. Thank you very much.
Thank you. Thank you.